Okay, so we just finished the health history part of the exam, and now we're actually going to move and do the physical assessment portion. So we're just going to do a head-to-toe physical exam. We'll start at the head and work our way down to the toes. So I'm going to start by examining your skin here in the front and back. So I'm just going to have you extend your arms here. Okay. On this side here. Great, thank you. Okay, now I'm going to inspect the chest and the stomach, and then your back as well. Going to move on and do your legs here. Okay, on this side. Okay. I'm actually just going to look at your fingernails on both sides. Okay, capillary refill is less than 2 seconds on both sides, which is great. You're going to check for skin turgor here, which is also good. Your skin does not tent, which shows that you're not dehydrated and your skin is elastic. I don't see any lesions. You don't have any tattoos, piercings, no masses that I'm aware of. You do have some nevi, which are just moles throughout your body and on your back there. They are not asymmetrical. They're not a normal color, and the borders are not irregular, and they are not greater than 2 millimeters at this time. So as of right now, all the moles are okay. So now we're going to move, and we're going to start with your head here. So looking at your head, I don't see any lesions, no masses. Your head is symmetric on both sides and round. I'm going to look at your hair here if you want to bow your head down. Your hair is evenly dispersed, is thick throughout. I don't see any lesions or any scars on top of your head, which is good. So I'm actually going to feel your temporal arteries. Great, okay. And the temporal arteries are equal and bounding on both sides at a +2 strength, which is what we want. So I'm actually just going to use the bell of my stethoscope here and see if I can hear any bruise. Great, okay. I did not hear any bruise while doing that, which is good. I'm going to move on and do your carotid artery next. So I'm going to be careful not to occlude both arteries at the same time because it can stop blood flow to the brain in some patients. Great, okay. So the carotid arteries were equal, again, symmetric on both sides, bounding at a +2 pulse, again, which is what we want. So I'm going to do the same thing and listen for bruise in the carotids. If you can actually take a deep breath and exhale, and then try to hold your breath while I do it on both sides. Okay, and again. Okay, great, and no bruise were heard while doing that as well. So now we are going to move on and take a look at your eyes here. So on exam, the upper and lower eyelids are intact. There's no ulcers or lesions. They are pink. The sclera is white, and the conjunctiva is pink as well. Thank you. Okay. The pupils are equal and round on both sides. I'm actually going to use my light here to look for both a direct and consensual reaction to the light. So what I'm looking for is both the light eye that I'm shining the light in to constrict, but as well as the opposite eye constricting, that the light is not shining in as well. So I'll just have you look straight for me. Okay, and one more time. Great, okay. And I did see a direct and consensual reaction to light. Pupils constricted on both sides, which is what we want. So now I'm actually going to move on and use the ophthalmoscope to look into your eyes here. I'll actually start on this side. Okay, so moving in, I see the red reflex. The optic disc is clear. I can visualize the fovea and the macula, and the vessels are evenly dispersed on both sides. Sorry for blinding you for a second. We're going to move and do the same thing here. Great, okay, and I see the same structures on that side. Again, the optic disc was an orangey reddish color. The disc was sharp. I didn't see any signs of papilledema, hemorrhage, or exudates on any side, which is great. Okay, so now we're going to move in, do your ears here. So I'm going to inspect the outer ear, the auricle, the tragus, and the lobe on both sides. So I'm not seeing any redness or swelling. No drainage or inflammation is present, which is what we want. I'm actually just going to flip this over here and I'll take a look inside your ears. Okay, just going to look into your ear canal here. All right, the ear canal is mobile, no redness or inflammation. I'm not seeing any drainage. The tympanic membrane is a pearly gray color. I can see the malleus, the incus, and the umbo in the cone of light there as well. I'm not seeing any signs of any bulging. Again, no redness or inflammation. There is some cerumen present at a small amount. That is completely normal. We're going to go to this side here. Great, okay. And the same thing on that side, the tympanic membrane is not bulging. It is a pink pearly gray color. I was able to see all the same anatomic structures in there. There was a little bit of cerumen in that ear as well, but that is completely normal. So now we're going to move on into the nose. From what I see, the nose is symmetric on both sides. Again, no lesions on the nose. It is a normal skin color, no abnormalities. And I'm actually just going to check patency first before I look into your nose. I'm going to have you close one nostril and breathe in. Great. And on the other side? Okay. Any problems with that? Okay. So now again, this might be a little bit uncomfortable, but I'm just going to look inside your nose here. Okay. The turbinates are pink. I'm not seeing any masses or lesions. No signs of any inflammation. On this side here. Great. Again, the turbinates are pink. No masses, no lesions on this side. The septum is midline, which is what we want. Great. Okay. So now I'm going to move on and do your mouth here. From what I can see by doing this exam, your lips are pink and moist. Doesn't look like they are dehydrated at all. No ulcers or lesions on the outside of the mouth. So I'm just going to have you open your mouth for me here. The buccal mucosa on both sides is pink, no swelling, no signs of any lesions or ulcers. The tongue is pink, a normal texture. Again, no ulcers or lesions or swelling on the tongue. I'm going to lift up your tongue here. And the salivary glands are also intact. They're normal color. I'm not seeing any masses or lesions down there as well. All right, one more time. I'll just have you say ah for me. Okay, so the tonsils are pink, no redness, no swelling, no exudate. The uvula is midline. The pharynx is also symmetric back there. It is pink. I'm not seeing any swelling, no lesions, and no masses in the pharynx as well. All right, so now we are going to move on, and I'm going to take a look at your neck here. So I'm actually just going to test some range of motion. So I'm going to have you shake your head yes. Perfect, and shake your head no. And then touch the sides of your ear to both sides. And then I'll just have you rotate your neck for me. Great. Any tenderness there? No? Okay, good. Okay, and so I'm actually just going to check your lymph nodes quick. So I'm going to start off by doing the occipital lymph nodes, the preauricular, and the postauricular. Okay, the tonsillar, the submandibular, the submental. Great, and I'm just, I'm gonna have you turn your head to the side here. I'm gonna check the superficial cervical, the posterior cervical, and then the deep cervical as well. Again, on the other side here. Great, okay, and then just the supraclavicular. All right, so there's no swelling in the lymph nodes. The ones that I did feel were mobile and soft, which is what we want. There's any tenderness while I was touching those? No, good. Okay, so no lymphadenopathy present. Okay, so now we are going to move on. And I'm going to look at your trachea and then your thyroid from the back. So for what I see, the trachea is midline. I can visualize the thyroid cartilage and the cricoid cartilage here as well. And can I have you swallow for me? Okay. Now I'm actually just going to come to the back and check your thyroid. Again, I'm just going to place my fingers under the cricoid cartilage there. Is there any tenderness where I'm touching? Okay. So there's no goiters, no swelling present. I'm just going to move your trachea here from side to side to try to feel the lobes. And the lobes are normal consistency. Again, no swelling, no tenderness, and no nodules noted. Can I just have you swallow for me? Perfect. And again? Awesome. Okay. All right. And now I'm actually just going to take a stethoscope here and listen to your heart sounds. So we're going to start off on the right side here. I'm going to go to the second intercostal space and start with the aortic. And the pulmonic. And the Erb's point. The tricuspid. And then the mitral. Great. I'm just going to go back and listen with the bell of my stethoscope here. Okay, I was able to hear normal S1 and S2 sounds. I did not hear any extra sounds, so no S3 or S4 was heard. So I'm actually going to move on, and we're going to look at your chest and your respiratory portion of the exam now. So from what I've been watching during this exam, you have normal breathing. The effort is normal. I'm not seeing any increased work of breathing. The rate and the rhythm has been normal throughout this exam. The diameter of your chest is normal. Again, I'm not seeing any discoloration, no lesions, no masses. Can you just breathe in for me? Awesome. Okay. And again. Great. Okay. A normal bilateral symmetric on both sides expansion there, which is good. So I'm actually just going to take a listen here to your breath sounds. You can just breathe normal for me. Great, okay, and I'm actually going to listen on the back too, so for the purpose of this exam, I'll just have you face the other way so the camera can visualize here. Perfect. Great, okay. Your lungs were clear and symmetric on both sides. You can actually turn around and face the camera now. I didn't hear any added sounds, which is what we want. So I'm actually going to now test for fremitus. So I'm just going to place my hands on your chest in different locations, and I'm going to check for the vibrations. So I'm just going to have you repeat 99 for me.
99, 99, 99, 99.
Okay, and again on the back, if you want to turn for the camera one more time. Perfect. Okay.
99, 99, 99, 99.
Okay, good. So those vibrations were loud and clear on both sides. Okay, so now I'm going to actually just percuss your chest here. So if you just want to relax, I'm just going to use my finger to hear your insides here. Okay, and then face the other way for the camera again, please. Thank you. Okay, great. So your lungs were resonant, which is what we want. Okay, so just to finish this exam, I'm actually going to have you lay down now. Yep, and just lay straight back, and I'll actually have you turn your head to the side here. I'm just going to look at your jugular vein, and you can just breathe normal for me. Okay, and I'm not seeing any jugular vein distension, and can you just turn your head to the other side? Perfect. Again, I'm not seeing any jugular vein distension on the outside as well. All right, so I'm just actually going to come back here and feel the PMI at the midclavicular line here. The position is normal. I'm not seeing any, any heats or thrills. Great, okay. So now we're actually going to move on to do the abdominal portion of this exam. So to start, I'm just looking at your abdomen here, inspecting it. The skin color is normal. I'm not seeing any abnormal pulsations. Your stomach is rounded and symmetric on both sides. I'm not seeing any abnormal vessels. Everything looks great. Okay, so now I'm actually just going to listen to your stomach here. Great, and I can hear bell sounds in all four quadrants, and they are normal. So I'm now actually just going to percuss your abdomen here. Okay, so the abdomen is tympanic, which is normal. Great, okay. And I'm actually going to try to see if I can percuss for your liver here. Great, okay, so there is a little bit of dullness over your liver there. Your liver is not enlarged, it's about 6 to 12 centimeters, which is what we want it to be. So I'm actually going to do the same thing over here and try to percuss your spleen. Okay, so I wasn't able to percuss your spleen, but that is normal in some patients. So there was no dullness heard. That could just be a sign that there's no splenomegaly or enlargement present, which is actually what we're looking for. So now I'm actually going to percuss your bladder. Just going to pull your shorts down a little bit. Okay, and I'm getting some panic sounds on your bladder as well. We did empty the bladder right before this exam. It would be dull if your bladder was full. Okay, so I'm going to take a listen for your aorta, and we're going to move on and do some of your arteries here as well. So I'm going to listen for your aorta to see if there's any bruise. Renal arteries. And the iliac arteries. And then I'm going to move your short sound to try to hear for your femoral arteries. So I wasn't hearing any bruise when I was doing that. I'm actually now just going to feel your femoral arteries on both sides. Great. Okay, and those are both symmetric, bounding equally on both sides, and again at about a +2 strength is where we want them to be. So I'm just going to check to see if we have any inguinal lymph nodes. Sorry. Okay, so no lymphadenopathy in the lymph nodes there. The ones that I did feel were mobile and soft, which is how we want them to be. And now I'm just going to move and palpate your abdomen here. Let me know if there's any tenderness to where I'm touching.
Yeah.
Okay, so the abdomen is soft, and I'm not feeling any abnormal lesions or masses. Good, hopefully that's it. I'm not feeling any abnormal lesions or masses, which is good. I'm just going to palpate for your liver here and see if I can feel it. This might be a little bit uncomfortable. Okay, the liver is soft and not enlarged. And I'm just going to actually have you take a deep breath for me, and I'm going to try to feel here for your spleen. And I'm not able to palpate the spleen there, but again, we already went over the spleen was not enlarged and I was not able to percuss it, so that's completely normal. I'm actually just going to try to feel for your kidneys here on both sides. Any tenderness? Okay. And on some patients, you're not able to palpate the kidneys as they're retroperitoneal, so that is okay. I'm not feeling any inflammation there. I'm just going to move on and do this side here. Good, okay. No tenderness there as well. All right, so now I can actually, I'll have you sit up for just a second. I'm going to feel the rest of your pulses here, and then I'll have you lay back down for the musculoskeletal portion. Just for the purpose of this exam, it might be easier for them to visualize if you're sitting up. So I'm going to feel your radial artery here. Okay, those are bounding equally at a +2 strength symmetrically. In your popliteal artery. Great, on this side. Awesome, and those are also bounding symmetrically on both sides at a +2 strength. And you might actually have to lay back down to see the others, just because the angle of the camera. So I'm going to move on and do the dorsalis pedis pulse. And the posterior tibial. Great, okay. So those two were also equal on both sides, bounding at a +2 strength, which is how we want them to be. So now we're actually going to move into the musculoskeletal portion of this exam. So for starters, we're going to look at the lower portion of your body here. So I'm going to inspect your hips. Let me know if there's any tenderness to anywhere I'm touching.
No.
Okay. And your knees.
No.
Okay. And this side here.
No.
Okay. And And then I'm just going to check out your ankles and the joints of your ankles. Great. Any tenderness to where I'm touching here?
Nope.
Okay. And your feet here. Any tenderness?
Nope.
Okay. So I don't see any erythema. There's no inflammation, no deformities of the musculoskeletal system of the lower part of your legs. So we're going to move on and we're going to do some range of motion. So I'm going to test your range of motion, both just in general and then against some resistance as well. So we're going to start off with your hips. I'm going to have you flex your hip here. So we're going to have you bring your knees to your chest on both sides. Okay, perfect. Okay, and we'll start with this one, and I'll actually just try to have you push against resistance here. Great. Okay, and this one here. Awesome. Okay, and for hip extension, I'm actually going to have you turn on your stomach. And so I'm going to take your leg here, and we're going to bend it, and I'm just going to have you push your leg up. Yep, just like this. Perfect. Okay, and I'm going to have you try to push up against my resistance. Great. Okay, and the same thing on the other side there. Again, this is testing hip extension. Perfect. All right, thank you. And then I'll have you flip back around for me. So we did flexion and extension. We are going to move on and do abduction and abduction. So I'm just going to hold your opposite hip here. I'm going to test abduction by moving your leg towards me. Any tenderness there?
Nope.
Okay. Now abduction, we're going to move your leg back across your body. No tenderness noted there?
Nope.
Okay. And again, we're going to do the same thing on this side. Okay. So we're going to do abduction and abduction. Great. Okay. And lastly, we're just going to do some internal and external rotations. I'm going to have you bring your knee bent up like that again, okay? We're going to do some rotations here. This is external rotation of the hip and internal rotation of the hip. Any tenderness there?
Nope.
Okay, so I'm going to have you do it against my resistance here. So I'm just going to have you try to push your leg out against my hand. Okay.
Show.
Yep, we're going to go in first. Perfect. In the other way. Great. Okay. And on this side here. First, I'm just going to test normal range of motion. So again, external rotation, internal rotation. Great. And now I'm going to have you try to push up against my hand here. Perfect. To the other way. Awesome. Okay. So for the hips, there is normal range of motion. Strength is at a +5, which is how we want it. Now we're actually just going to move down to the knees here. So for flexion and extension, I'm actually going to have you bend your knee and straighten your leg, sorry. Perfect. Yep, just like that. Okay, and again, against resistance, we're going to have you flex. Yep, and then extend. Great. Okay. And the same on this side here. I'm going to have you bend your knee for flexion and extension, straighten your leg. Okay. Now against my resistance here, flex your knee. Okay, and extend your leg. Perfect. Okay. All right, now we are going to move on to your ankles here. Okay, so we are going to do some inversions. I'm going to have you turn your toes in towards each other. Great, an eversion, toes out. Perfect, and now against my resistance, so push your feet in. Awesome, and out. Okay, now we're going to do some plantar flexion and dorsiflexion. So plantar flexion, your feet are going to go towards the ground. And then you're going to do dorsiflexion, feet up towards the ceiling. Great. And now again, some resistance. So pushing down like gas pedals. And then lifting back up. Awesome. Okay. So for the lower musculoskeletal portion of the exam, everything was at a +5 strength, normal range of motion, both by itself and with resistance, which is good. So now you can actually sit back up. And we're going to do some musculoskeletal exam for the upper portion. So I'm actually just going to take a look at your shoulders here. Okay. Any tenderness to where I'm touching?
No.
Okay. So I'm going to feel for the clavicle here in the supraclavicular joint. Okay. In your medial epicondyles, in your lateral epicondyles. Acromioclavicular joint. Perfect. Okay. We're going to move down to your hands here. Any tenderness in your wrist?
No.
Okay. All right. So I'm just going to take a look at your joints here. Your MCP joints, your PIP joints, and your DIP joints. Any tenderness there?
No.
Okay. And again on the other side. Okay. Again, your MCP and your PIP, and then your DIP joints. Any tenderness on the side?
No.
Okay. So there's no erythema there, no swelling or deformities of any of the joints. The joints were boggy, or no bogginess, and they were soft, which is what we're looking for. So now we're just going to do some upper musculoskeletal exams. So starting with your shoulder, we're going to do shoulder flexion. So we're going to extend your arms out front. Perfect. And then extension out back. Great. Okay. And so now against my resistance, a flexion. Awesome. And extension. Great. Okay. So we're going to do abduction, which is just moving your hands out to the side. And then adduction down and cross the midline. Perfect. Okay. Now we're going to do against my resistance here. Great. And then in. Awesome. Okay. Now we're going to do some inversion, or internal rotation and external rotation. I'm going to have you put your hands behind your neck here. And then down for internal rotation. Okay. And again, some external rotation. Awesome. In. Perfect. And then down again. Okay, awesome. So again, normal range of motion there at a +5 strength, which is good. So we're going to move down to your elbows. We're going to do some flexion and extension. And then we're going to do some supination and pronation. Yep, perfect. So now we're just going to do that against my resistance. So some flexion. Great. And extension. Awesome. And then some supination and pronation. Great. Okay. Again, everything there was normal range of motion at a +5 strength. So we're going to move on to your wrist here. I'm going to have you put your palms down, and we're going to do some flexion and extension, and then we're going to do adduction and abduction, okay? And again, just against my resistance here, so we're going to do some flexion, perfect, extension, great, adduction and abduction, perfect, okay. So moving on to your hands, we're going to do some flexion of your fingers. So make a fist, and some extension, strengthen your fingers, adduction, put your fingers together, and abduction away. Okay, so make a fist. Okay, and extend them. Perfect. All right, and now we're just going to do some grip strength here. So I'm going to have you squeeze my fingers. Awesome. Okay, and lastly, we're just going to do some opposition. So you're going to take your thumb. You're going to touch it to each of your fingers here and back. Great, so that's all one smooth motion. Again, for the upper musculoskeletal, everything was great, normal strength at a +5, range of motion was intact. Okay, so now I'm actually going to have you face this way one more time just for the camera. And I'm going to inspect your spine here. So I'm seeing a normal posture right now, normal curvature of the spine, no signs of scoliosis, lordosis, or kyphosis. So I'm going to palpate here for the cervical and the thoracic and the lumbar spine. So the spinous processes are intact, nothing feels out of place. Any tenderness to where I'm touching? Okay, no tenderness and no swelling. So I'm just going to feel the surrounding spinal muscles here. Any tenderness to where I'm touching?
No.
So I'm not feeling any spasms of the muscles there, no swelling, no tenderness, no masses or lesions. Okay, great. Okay, so we are done with the portion of the musculoskeletal exam. So now we're actually going to move on and do the neuro exam. So I'm going to ask you some silly questions to start with. Do you know your name?
Yes.
You can tell me your name.
Sebastian.
Do you know where you're at?
Yes. My apartment.
Okay.
Tampa.
And do you know about what time it is?
Yes. 6 o'clock.
Okay, perfect. Okay, so now I'm going to test your memory. So we're going to do some remote memory and then recent memory. So for recent memory, I'm going to have you repeat a few things back to me. So we'll do car, duck, purple, house.
Car, duck, purple house.
Perfect, okay. And so for remote memory, can you tell me what you did on your birthday last year?
Had cake.
Okay. And now we're just going to test your reasoning here. So we're going to do something that's called the serial sevens. So I'm going to have you start at 100 and count down by sevens.
100, 93, 80, 87, 80.
Okay, thank you. Okay. All right. So now we are actually going to do, we're going to do some stuff with the cranial nerves. So we're going to do the 12 cranial nerves. So I'm just going to have you close your eyes for starters. We're going to test cranial nerve 1, which is the olfactory nerve. I'm just going to have you tell me what you're smelling.
Cinnamon.
Okay, great. So cranial nerve 2, we're going to test, you can open your eyes, I'm sorry, is the optic nerve. We're going to test your peripheral vision here. So I'm just going to have you tell me when my fingers come into your visual field, all right?
Now.
Okay.
Now.
Okay.
No.
Okay, great. So cranial nerve 3, 4, and 6, we're going to test for some extraocular eye movements. So I'm going to have you look at my finger here, and you're just going to follow them, all right? Great. And follow my finger in. Awesome. So no extraocular movements were noticed during that exam. So we're going to move on to cranial nerve 5. And for the sensory portion, I'm actually just going to have you tell me when you feel this on your face. You're going to close your eyes for me, and you'll just say now when you feel it.
Now. 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 Now.
Great. Okay. You can open your eyes again. And so for the motor portion of that exam, I'm going to have you clench your teeth and move your jaw from side to side. Yep. Perfect. Okay. So moving on to cranial nerve 7, the facial nerve. I'm actually just going to have you close your eyes as tight as you can. Perfect. And raise your eyebrows for me. You can open your eyes back up. Thank you. And you can smile and frown and puff out your cheeks. Perfect. Okay. So moving on to cranial nerve 8 is the acoustic nerve. So we're going to test your hearing. So first I'm actually just going to have you cover one of your ears. And I'm going to repeat 3 numbers to you. And I'm going to have you whisper them or tell them back to me, okay?
3, 6, 9.
Okay, and again on the other side.
2, 4, 8.
Awesome, okay. So for this next portion of the exam, the Weber test, I'm going to set this into vibration, and I'm going to set it on the top of your head, just like this. And you're going to tell me if you hear it more on one ear or both ears.
Do it again. Right here.
You hear it more on the right ear, not lateralized to both.
Can you try one more time? Lateral.
You can feel it on both sides? Okay. Great. Okay. That's what we want. We want it to be lateralized on both sides. So now we're going to move on and do the Rhine test. And for this, I'm going to again set it into vibration. And I'm going to put it on the back of your ear here. And you're going to tell me when you stop hearing it. When you stop hearing it, I'm going to move it up to your ear like this. And you're going to listen and tell me when you stop hearing that as well. So what we want is we want you to be able to hear it through the air longer than what you hear it through your bone. Okay. So again, just tell me when you stop.
Stop. Stop.
Great. Okay. All right. And so for cranial nerve 9 and 10, we're not going to do it for the purpose of this exam, but I would be testing the gag reflex of the patient. So for cranial nerve 11, the spinal accessory nerve, I'm actually just going to have you shrug your shoulders against my resistance here. Great. And then I'm going to have you turn your head side to side against my hand here. Perfect. And this one? Great. Okay. And so for the last cranial nerve, I'm going to have you protrude your tongue out and move it to side for me. Awesome. Okay. Thank you. So now we're going to move on and we're going to do the cerebellar portion of the exam. So the first thing we're going to check is for rapid alternating movements. I'm going to have you take your hands and you're going to hit your thigh and turn it back out. Yep, just as fast as you can. Great. Okay, so after that, I'm going to have you close your, I'll explain it first, then you're going to close your eyes. So I'm going to have you close your eyes, and you're going to touch your nose, then you're going to touch my finger a few times, but you're going to do it with your eyes open first. Then you're going to close your eyes, and you're going to try to still touch my finger, okay? Okay, so then finger to nose. Perfect, and you can close your eyes and do it. Perfect, okay. And the next thing we're going to do is you're going to take your heel, and you're going to rub it down the opposite side of your leg. Okay, and the other side. And now you're just going to do that with your eyes closed. Perfect, okay. So normal position sense there. And the last thing we are going to do is I'm going to, again, have you touch your nose and then touch my finger. But your eyes are going to be open for this one. Great, okay. So I wasn't seeing any tremors while we were doing that at rest or with movements. That was all one smooth motion that we were doing. The position sense was intact, which is all the good things that we are looking for. So now I'm actually going to take this here. We're going to move on to the sensory portion. So I'm going to test your upper and lower extremities. So this is going to be sharp, and this is going to be dull. So I'm going to have you close your eyes, and you're going to tell me which one you're feeling.
Soft. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Sharp.
Okay. And on your lower extremities here.
Soft. Sharp. Soft. Sharp.
Okay, good. Okay. And then we're going to move on, and I am going to do just soft touch here. So you're going to close your eyes, and you're going to tell me when you feel the fine touch. So you could just say now whenever you feel it.
No. 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 No.
Okay. So now we're going to test for some vibration. So again, you're going to close your eyes, and you're going to tell me. Well, first you're going to see if you can feel the vibration, and if you do, you're going to say yes, and then you're going to tell me when it stops, okay?
Do it again. You're not doing it. You do it one more time if it's not. Go for it. No. 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 And sorry. No. 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 No.
Great. Okay. And so the last thing for the sensory portion of the exam, I'm going to have you close your eyes, and I'm going to put two things into your hands, and you're going to tell me what they are.
Close my eyes now.
So for the first object here,
A quarter.
good job. And the other object here.
A bottle cap.
Perfect. Okay. So the senses were intact for that portion of the exam. So now I'm actually going to use my reflex hammer here. I'm going to test your reflexes. I'm going to have you, you can just rest your arm slightly flexed here. We're going to do the brachial. Okay. And the triceps. Okay. Great. Okay. Now we're going to do the brachioradialis here. I'll just have you again. You can rest your arm there for me. Okay. And this side here. Great. Okay. I'm just going to lower this here so we can make sure that we get it on the exam. So now we're going to do the patellar. Great. And the Achilles on both sides. The Achilles on this side. Great. Okay. And again, I'm just going to lower this a little bit longer. So I'm now going to test for the Babinski reflex. So I'll have you, perfect. Okay. And the Babinski reflex was normal for that. Okay. So the last portion of the exam, you can stand up and we're going to check for your gait. But first I'm actually going to assess your sides if you want to turn around for me. Okay, we're going to do some spinal movements. So I'm going to have you bend to the side here. Yep. And the other side, bend at the hip, exactly. And then I'll have you do rotation. Awesome. And the other side, great. And then I'll just have you extend like you're cracking your back. And then forward flexion, I'll have you touch your toes. Okay, so normal range of motion of the spine there. I wasn't seeing any abnormalities. It's all one smooth motion, which is good. Okay, so I'm just going to have you walk back and forth, and I'm going to look at your gait. Okay, your gait is steady and smooth, no abnormal movements. Can I have you walk on your tiptoes for me? Great, and then your heels. Awesome. Again, those are all smooth movements there. You can actually stand in the front here. No rigid movements. Noted. And for the last thing here, I'm just going to use my stopwatch, and we are going to do something called a Romberg test. So I'm going to have you close your eyes, and you're going to stand with your feet together, and you're going to try to hold that for 30 seconds with your eyes closed. Perfect. Okay, you can actually have a seat. The Romberg test was normal. I'm actually just going to take a second and I'm going to look through my notes here just to make sure I didn't miss anything. So it'll just take about 1 to 2 minutes so you can just relax. So I just wanted to make a note that when I was looking at your gums as well, the gums were pink. They were at any redness, no swelling, no abnormalities of the gums. And lastly, I'm just going to check for your sinuses here. So I'm going to check your maxillary sinus and your frontal sinus. I'm just going to percuss them. Okay. And they are resonant. Was there any tenderness to when I was touching? No?
No.
Okay. The sinuses are not swollen, not inflamed, which is exactly how we want them to be. Perfect. Okay. So that completes the portion of our exam. I want to thank you for taking your time to help me today. Everything that we found on exam was completely normal. So I just recommend that you follow up within a year for another physical exam. Unless anything arises, then you can always come back for another visit. All right. Thank you.
Thank you.